Hi, my name is Carolina. I am studying physiotherapy. I study because it's a humanist career. We have a direct contact with the patient and I love talk with the people. The main object is to help them to reduce their pain and that is why I love it. And this is my partner.
Hi, my name is Anna. I study physiotherapy too. I start to study this career because I think that is very important branch of medicine because not only help with the functionality in the joints, also to reduce their pain. We are in the 5th semester.
Physiotherapists help people affected by injury, illness, or disability through movement and exercise, manual therapy, education, and advice.
Physiotherapy can help you to become stronger and more flexibility, increase freedom of movement and mobility, breathe easier, reduce pain, stay activity, and prevent injuries. We are going to talk about the fracture. A fracture is a bone. It can range from a thin crack to complete break. Bone can fracture in several places or into many pieces. Most fractures happen when a bone is impacted by more force or pressure that it can support. If you suspect you have a fracture, seek a medical immediately.
Most fractures are accompanied by intense pain with the intense injury occurs. It may become worse that you move or touch the injured area. In some cases, you may even pass from the pain. Other potential symptoms in a fracture is snap or grinding when the injury occurs, swelling, redness, and bruising in the injured area, difficulty supporting when with the injury area, visibly deforming in the injury area.
There is a range of fracture types, including comminute fracture. The bone is broken in many places. Compression fracture generally occurs in the sponge bone in the spine. Fracture dislocation. A joint becomes dislocated and one of the bones of the joints has a fracture. Hardline fracture, a partial fracture of the bone. Sometimes this type of fracture is harder to detect with routine X-rays. Impacted fractures. When the bone is fractured, one fragment of the bone goes into another.
The break is along the length of the bone. Oblique fracture. A fracture that is diagonal to the bone is long axis. Pathology fracture. When an underlying disease or a condition and really weaken the bone. Spiral fracture. A fracture where at least on one part of the bone has been split. On the transverse fracture, an strain big break right across the bone.
Causes of the fractures. You can develop a fracture when your bone is impacted with greater pressure or force than it can support. This force usually occurs suddenly or is very intense. The strength of the force determines the severity of the fracture. Some common causes of fractures include falls, direct strikes to your body, traumatic events such as car accidents, injuries from sports.
Fracture diagnosis. A doctor will carry out the physical examination, identify signs and symptoms, and make a diagnosis. Doctor will often order an X-ray, in some cases an MRI and CT scan may also ordered. Treatment also focus on the problem in the injured bone with the best circumstances for optimal healing. The patient is usually left under a general anesthetic when fracture reduction is done. Fracture reduction may be done by manipulation, close reduction, and surgery.
As soon as the bones are aligned, they must stay aligned while they heal. If a broken bone has been aligned properly and kept immobile, the healing process is usually fast and good. Osteoclast bone cells absorb old and damaged bone, while osteoblasts, other kind of bone cells, are used to create new bone. Callus is new bone that forms around the fracture. It forms on either side of the fracture and grows toward each end until the fracture gaps is filled. The patient's age, which bone is affected, define the type of fracture, as well as the patient's general health are all factors which influence how rapidly the bone heals. Therapy physical. After the bone has healed, it may be necessary to restore muscle strength as well as mobility to the affected area. The individuals may not be able to bend the joint as well as before.
Complication: persistent bone or bone marrow infection. If there is a break in the skin, as may happen with a compound fracture, bacteria can get in and infect the bone or bone marrow, which can become a persistent infection. Patients may need to be hospitalized and treated with antibiotics. Heals in the ground position. This is known as a malunion. Either the fracture heals in the ground position or it shifts.
Treatment. One of the keys to successful rehabilitation in communication, effective management fractures depends on collaboration among the surgeon, therapist, and patient. Head. Head may be delivered by multiple routes, including heating pads, moist head, water or the paraffin beds, heating lamps, and ultrasound. The optimal range for chemotherapy is 41 degrees to 45 degrees. Traditionally, superficial head is considered and depth of less than 3 centimeters, whereas deep heating reach tissue beyond this level, because the anatomic tissue layers and capsulo-ligamentous structures of the hand are more superficial than those other parts of the body. Simple topical heat options are kept effective and most commonly used. During the early inflammatory
phase of the fracture healing. Head application increases local circulatory volume with the vasodilatory effect on small capillary beds. Increased blood flow assists in reducing local edema and the presence of soft tissue pain mediator. Strengthening. Once fracture healing has occurred and range of motion has been restored, progressive strengthening exercise may be incorporated into the therapy regimen. Muscle strengthening further enhances soft tissue glide and range of motion therapy, preventing late adhesion formation. Motion. Active motion is under direct patient control via cortical presence and activation of the musculotendinous units. Active range of motion exercise generate tendon gliding, promote strength and endurance, and enhance lymphatic drainage. Electrical stimulation. Electrical stimulation targets not only pain but also neuromuscular response. Therapeutic pain modulation is termed transcutaneous electrical nerve stimulation, TENS. When applied at the frequency that is just tolerable to patients, the electrical stimulus produces a local tingle sensation and elevates the pain threshold. Neuromuscular electric stimulation, on the other hand, directed generation contraction of special motor units and may be used to preserve motor recruitment and functional capacity of innervate muscle follow injury, and well as the strengthened muscle after prolonged disuse.
Ultrasound therapy. Low intensity ultrasound is applied to the affected area daily. This has been found to help the fracture heal. Studies in this area are still ongoing.
Include many pieces.
Strengthen also focus.
No, espera, es que está mal. No, es que
Es que dije muy
tú empiezas. No, yo empiezo. For,
Hi, my name is Carolina. I am studying physiotherapy. You may edit parts of the
Investment in infrastructure may be the trigger of a
they maintain help for people of all ages, helping patients and manage pain.
of the existence of not only a dual economy, that is, of thriving
is fine with the injury occurs. It might become worse that you move or touch the injured area. In some cases, you may edit past
summary, the facilitator of our development processes. Rich and developed zones with high standards of living coexisting with the